Montana's COVID-19 infections continue to surge, as we've been talking about, and so many of us just want to know when and how will it stop, or at least just slow down. MTN's Mike Dennison posed those very questions and more to the state's top infectious disease specialists this week. Here's what they had to say.
Dr. Greg Holtzman is Montana's state medical officer at the State Department of Public Health and Human Services. He says a vaccine for COVID-19 may be available as early as next month. But access to any vaccine will be in stages, he says, and is not the only solution that's needed.
But if we sat here and waited until everybody got vaccinated, we're going to lose a lot more lives and have a lot more people suffering. So we want to move now, doing all the public health interventions.
And according to Holtzman and Jim Murphy, the head of Montana's State Bureau of Communicable Disease Control and Prevention, that means adhering to some basic guidelines to prevent the spread. Stay home as much as possible and limit personal contacts. If you do go out, keep 6 feet apart. And when interacting with those outside your personal circle, wear one of these, a face mask. Both men say a lack of compliance to these simple directives has fueled the spread of COVID-19, leading to more than 1,000 new cases a day this month in Montana.
If you look at the estimates of masking use in Montana, we're well below where you would want to be in order to help contain the spread of this.
We need people to be all working together, and you can't have a large proportion deciding not to follow the guidance and expect the virus to go away.
Murphy says health professionals expected a surge once the weather turned and people moved indoors in closer contact. But the relentless increase in cases is putting extreme stress on Montana's hospitals and healthcare system, stretching their ability to deal with other illnesses or accidents.
Just go to any of the ERs and see how many people are coming in that they're not sick enough to actually end up in the hospital, but the ER providers are seeing these patients, trying to take care of them, get them in the right sense, and give them the guidance of what to do and to come back if things get worse.
And while many COVID-19 cases may have mild symptoms, the disease still has killed more than 650 Montanans, more than 1% of those contracting the virus.
If everybody in Montana, was a victim of COVID or got COVID, and 1% was our fatality rate, that's 10,000 Montanans that you would lose during that time. That's a sobering number for some folks.
Reporting from Helena, Mike Dennison, MTN News.
And you can see Mike's full interview with Greg Holtzman and Jim Murphy on our website.